The COVID-19 pandemic has exposed weaknesses in the world's ability to track and respond to major infectious disease outbreaks. The 2014 to 16 Ebola epidemic in West Africa showed up long-standing weaknesses in the international health system and how prepared it was for a major outbreak. 4 years on, and even countries thought to have strong response capabilities failed to detect the early signs of coronavirus outbreaks or respond quickly enough. That meant that community transmission of the virus was already well established before governments could react. Think tanks and public policy institutes alike have been pushing for massive investment in outbreak response and care capacity. Pandemic preparedness has been described as a global public good. And yet, globally, it's been left up to national public health systems to carry the largest burden of cases and the bulk of the costs. Outbreaks and resurgences of coronavirus cases are stretching public health systems the world over. Local and national governments keep having to make drastic measures to prevent services being overwhelmed. They have to act fast to get ahead of this virus.
Stagnation in a place where people would normally be having fun. This is not how Uwe Röhrig had imagined things. His fair had only just opened when he had to close it down again because of a drastic increase in corona numbers in the Westphalian city of Ham. We've put our heart and soul into this, weeks of work. It's really tough, it's shocking. We haven't earned any money all year, and now we're having to write off potential income. And all of this because of a single wedding celebration, where more than 100 people were infected with the coronavirus. We're not to blame. As far as anyone can tell, there hasn't been a single instance anywhere of numbers going up in any way around a temporary leisure ground. Nonetheless, we're the first to feel the full impact. And it's frankly depressing that we are the ones who always end up paying the price. The closure of the fun fair was only one of the measures ordered by Mayor Thomas Hunsteger-Petermann in a bid to get infection rates under control. He says he's now looking at how private festivities can be better monitored. We're keeping 150 as the upper limit in Ham because we don't want anybody to start cancelling a wedding or a silver wedding anniversary. But up to 25 people, these occasions don't have to be registered. From 25 to 50, there must be advance notice so that we know what's happening and where. And from 50 to 150, they are subject to approval and will be taking a very close look. Many in Ham are asking themselves how the couple in question could have been so unreasonable. So far, not everybody who is infected has been tracked down. The mayor is relying on volunteers who trace possible victims. People like retired doctor Peter Rode. It really pushes you to your limits, especially for people working at the local health offices who are organizing this whole operation. It's a real pity that it's had to come to this. I personally believe it could have been avoided. Meanwhile, fairground operator Uwe Röhrig is now faced with the dismantling of his fair. I just hope we can get back to life as normal, that we can take part in fun fairs and other festivals as we always have, and I hope we can help make people a little bit happy. For now, though, fun is on hold.
Well, we can now speak to Dr. Ezekiel Emanuel, who is a professor of healthcare management at the University of Pennsylvania in the US. We're months into this pandemic now, Dr. Emanuel, and global health systems, are they now in a better position to cope with the coronavirus outbreaks, or have they been weakened by these months of sickness?
No, I think in general, certainly in the advanced countries, they are better able. We know how to manage patients better. We know not to intubate them, to give them high-flow oxygen. We know how to use anticoagulants. We know to use dexamethasone. So we have a lot more knowledge about how to manage these patients and which ones really need to be in the intensive care unit. Nonetheless, if you have a large number of cases, you can overwhelm the system, and I believe the French are, teetering on that problem right now.
Yeah, what do you think? I mean, are advanced countries any more ready for a second wave than they might have been for the first one, particularly when we're seeing that some of these second occurrences are coming with even more cases than the first time round?
Yes, that is worrisome. Look, the systems can be overwhelmed if you have too many cases. We do, I think, have, again, better management, but we also need to have better surge capacity, the ability to quickly put up temporary facilities in, mobile units or tents, and that's going to be necessary. We predict that you're going to have repeated waves here for the influenza of 1918, 1919. It also extended to 1920. There were 4 waves of it, actually more small echoes of it. So we've got to be prepared for that to happen, and part of that preparation is surge capacity.
During the course of this pandemic, have we seen certain styles of public health system that are working better than others?
We have. I mean, systems that were able to quickly implement testing, contact tracing, and suppression. They've kept the number of cases very low. You can look at Taiwan, Singapore, South Korea, Japan as real models here. Germany itself did a remarkably good job of keeping the death rate extremely low. So there are places that have done well. But even places that surged, like Italy, they were able to put public health measures in place, the social distancing, the avoiding crowds, the face mask wearing, the closing of non-essential businesses. And in 8 or 10 weeks, they were able to bring the numbers very, very low. And that does show you that even without a vaccine, using public health measures, you can actually bring the case numbers low and then begin to open up the economy. It's very important, once you have the case numbers low, life can resume, not completely to normal, but lots of freedoms can be reintroduced under those circumstances.
Are there health systems on the other side of that we've actually seen performing less well than we thought they might have under these conditions?
Yes, the United States is a really good example of that. We've just done a terrible job. And in large measure, the terrible job has been the fact that we've had, we're a very big country, 4 times the size of Germany, for example, and we've had a haphazard response. So some states are doing a very good job of closing non-essential businesses, wearing face mask distancing, while other states like Georgia and Florida just aren't. And once that happens, people travel, they bring the virus with them, and it reignites cases. So we saw it go from New York to the South and the West, and then up the Midwest in the United States. And it's raging. We're back up to double the number of cases we had in June, because states like Wisconsin and Missouri in the middle of the country are just having large-scale spread because they ignored the public health measures.
It's been very tough for the United States. Dr. Ezekiel Emanuel, thank you so much for joining us.
Thank you.
Now it's time for one of your questions to our science correspondent, Derek Williams. Today comes from someone calling themselves Eric Cartman.
How do you make a vaccine for something that mutates?
I get asked this a lot. To answer, we have to look at the process of evolution. Now, just like with living organisms, the genetic code that governs how a virus is made changes from generation to generation, sometimes in small ways, sometimes in big ones. The progeny, if they survive, eventually will become separate strains that are distinct from their common ancestor. Their genetic code has changed, and that can change how they look, their structure, and also how they interact with potential hosts. For example, whether they can cause more or less severe illness. What's key to creating a vaccine is the speed at which these changes occur. In viruses like the ones that cause influenza, for example, which have genomes that are less stable, The rate of change is so rapid and random that we need a new vaccine to fight them every year. We have to play catch up with flu bugs all the time. Fortunately, due to the way that SARS-CoV-2 makes copies of itself, its genome remains relatively stable. As far as we can tell, worldwide, there isn't a lot of genetic variation yet among all the novel coronaviruses circulating in different parts of the planet. And because those groups are so homogeneous, theoretically, a vaccine that can prevent one should be able to prevent them all. What's interesting and kind of scary is that when we start to prevent infections with a vaccine, we'll also start forcing SARS-CoV-2 to change in ways that will allow it to get around the vaccine. But that's a different question.
Now let's have a look at how the world is doing in terms of coronavirus cases. A look at data from 209 countries and territories over the past 4 weeks tells us the number of new cases has doubled or worse in 35 countries. They also increased, though at a lesser degree, in a further 77 countries. 6 countries have seen case numbers rising at around the same rate. 61 countries have seen their new COVID-19 positive cases go down by anything up to half, and 21 have seen them more than halve. Meanwhile, 9 countries have reported no new cases for 4 weeks in a row. Here's that bar graph compared with the last few weeks. Remember, the battle is won when that entire chart is blue. We still have a long way to go.